It is 6:53 on the WMT Morning Show. I'm joined by Dr. Tammy Penhollow on the Newsmaker line here on News Radio 600 WMT. Thank you very much for hanging out with us this morning here. A former active duty U.S. naval officer. You've lived, practiced, been deployed across the U.S. and overseas. I'll tell you what, the active lifestyle that you have really comports with what a lot of people need to do. But also, Dr. Penhollow, being active as far as oral care, you're stressing that could help you prevent or push off coronavirus COVID-19. Good morning. Welcome to the WMT Morning Show. Please explain, would you?
Good morning, Doug. Yes, we're looking at a powerful agent as just simple mouthwash. Having good oral health is just one of the body's natural defenses. So if we talk about having daily brushing and flossing, we can keep our bacteria under control, but a lot of people are on significant medications that decrease our saliva production. So that's another one of our good neutralizing acids and flushing away those bacteria, maybe even some viruses. So if we don't have all of our good natural defenses in order, we might be susceptible to not only the COVID-19, but other bacterial and viral infections. Yeah. So we're looking at a powerful agent as just simple mouthwash.
Now, is there, like, for example, when we're doing the hand sanitizer, they recommend a hand sanitizer with at least a 60% alcohol content. Is there anything as far as minimums with regard to mouthwash that people are recommending? I, for example, use a whitening peroxide-based mouthwash that foams up. I like that one just because of what it does.
I personally do as well, but right now we haven't done enough studies. The studies that have come out of 3 universities in the U.S. were industry-sponsored. So sometimes we have to take that with a little bit of, I'm not sure about that. Yeah. However, we do have some good evidence that shows that there are several ingredients in different mouthwash components that are effective, and I don't think it's going to be at a percentage level. I think it's simply having one of those ingredients involved is what's going to disrupt the viral envelope. That's like a hard shell coating of the COVID-19 virus, and the peroxide or chlorhexidine, acetylpyridinium chloride, or even povidone iodine can disrupt that membrane and kill the virus. But I have to say, and I know it's weird that in this time and day that we have to say this, the mouthwash should only be gargled. No drinking of the mouthwash.
Exactly. I know.
Don't swallow.
You watch some episodes of some of these shows where people have addictions where there's like, oh, really? Come on. That's not good for you. Dr. Tammy Penhollow, a doctor of osteopathic medicine. She specializes in anesthesiology, pain management, and regenerative medicine, joining us on the Newsmaker line here on News Radio 600 WMT. It's critical how the pathway, the oral pathway, that's the beginning of it, how critical the good health there is for both gut health as well as respiratory health. And respiratory health is what the COVID-19 coronavirus attacks.
It does even attack the gut. There are some patients who their very first or their prominent symptoms are gut-related, such as diarrhea. So this really is great that we can start and look at 2 different systems, both the gut and the respiratory system, with the mouthwash.
I did not realize that. I guess I hadn't followed it that closely to see that was the case. So, one more time, I think the big thing is for everybody is something that you were told when you were a kid. Brush twice a day, make sure you floss regularly, and make sure you're using a mouthwash in order to help not only fight COVID-19 but other viruses and other bacteria as well. Hey, Dr. Penhollow, thanks so much for joining us here on the WMT Morning Show. We certainly appreciate it. Hope you have a terrific Tuesday, would you?
Thank you.